Hey everyone, Dr. Nguyen here. Let's talk about capsular contractures, okay? So anytime you place a breast implant in a woman's body, the body will form a membrane around the implant. It's a natural reaction, and that membrane is called the capsule. Now, for the most part, the capsule is very thin, very pliable, and you never really feel or know that it is there. In a very small percentage of women who undergo breast augmentation, typically less than 5%, that membrane can thicken and harden and calcify, and it can cause problems such as distortion in the shape of the breast, displacement of the position of the implant, and also it can cause symptoms such as pain and discomfort, okay? The classic classification for capsular contractures is the Baker classification, which generally is Baker class 1 is a soft breast that looks very normal. Baker class 2 is a slightly firm feeling breast that looks very normal. Baker class 3 is a firm breast on exam that has some distortion of the breast due to the contracture of the capsule, displacing the implant, and also changing the shape of the breast. Baker class 4 is a very severe contracture causing distortion of the breast, a very firm feel to the breast, and also it can cause symptoms such as pain and discomfort. So the causes of a capsular contracture is still not very well understood. There are some techniques that most plastic surgeons employ to help minimize the incidence or risk of capsular contracture. Some of them include minimizing the pocket dissection as much as possible, a bloodless operative field, meaning not leaving a lot of blood in the breast space or pocket because blood is very irritating. Employing a so-called no-touch technique, in which I use a Keller funnel to insert the implant, and this funnel allows me to insert the implant without actually touching the implant at all. And then finally, probably one of the most important factors is selecting a proper size for our patient's anatomy and pocket space. So if you have a capsular contracture, what can be done? Well, number one, it is not a surgical emergency, but it tends to progress and it can cause pain, discomfort, etc. So the surgery generally involves making the same small incision and removing the capsule in the old implant, maybe reconstructing the breast pocket and then replacing it with a new implant. Now, in my hands, I also like to create the internal brawl to help basically insulate or separate the implant from the surrounding tissue and completely isolating the implant under the submuscular space. And I do think in my practice it does help decrease the risk of a recurrence of capsular contracture. In a minute, I will show you an example of a very severe bilateral capsular contracture in a patient of mine. I successfully removed the implant and capsule intact. And I've cut it open to show you the interior surface of the capsule. It's very calcified, has really sharp edges to some of the plates of calcium that has formed on the inside, and it'll give you a better idea of why the breast would feel so firm and then also cause some discomfort and distortion of the breast when the capsular contracture gets this severe, okay? And exchange of implants, and notice these implants are brand new looking, so the capsular contracture really doesn't have anything to do with the implant as far as the implant function itself. It's just really that membrane that your body forms around it. Let's look at the capsule. So these are the capsules I removed from these around the implants. Okay, this surrounds the implant. Now here's the issue. Let's turn it inside out so we can see. You can hear the crunchiness and look at all this calcium, okay? So these implants are really indestructible. You can stand on it, it won't break, but look at how sharp these edges are. Is it possible over time rubbing on this will cut through the implant membrane? Possibly, but look at this. So this will cause pain, discomfort, especially if one of these edges happens to be pushing on the breast from the inside. It's really sharp, and you can hear how hard it is. It's like an eggshell. Okay, so that's one.